Hi everyone, I'm Stevie, Chancellor from Northwestern University. Today I'm going to talk to you about the promises and perils of AI for mental health on social media. Before I get started, I study high-risk behaviors, and I'll be discussing and showing photos from my data sets around topics such as suicidal ideation, eating disorders, and addiction. There are some graphic photos in this talk, which is why I want to pause and warn you that those are coming up. Facebook recently deployed an algorithm to predict whether someone may be suicidal on their platform. According to NPR, 10 or so people are picked up by this system per day who may be considering taking their own lives. Interestingly, these people were not otherwise reported to the platform through traditional reporting or intervention techniques. That means that Facebook may be finding 3,600 people a year that may have the potential to actually save their literal life. Now, it's not only in Facebook, but in research. We've been able to predict mental illness in social media data for the last 7 to 8 years. And now we're finally seeing adoption into industry practices and apps. And it's really exciting for me as a researcher as I watch some of my own technologies get adopted into practice with social networks, as well as mental health apps that are designed to help people improve their well-being. So today I'd like to talk to you a little bit about some of my research in using AI, what I'm using for the term machine learning, and social media for mental health. I'll talk to you about my work in high-risk mental illnesses, which focus on behaviors that are physically dangerous for well-being. These are things, as I mentioned, like suicidal ideation, disordered eating behaviors, and self-harm. Now, in addition to the immediate physical risks that these behaviors pose to well-being, I think these behaviors are really interesting as they expose social responsibility and ethical obligations of us to intervene in what could be, for some of these behaviors, life-saving opportunities for people, and how we can use AI to support these kinds of decision-making platforms, and if it's a good idea to make interventions in social media sites to stop these behaviors at all. So first, I'm going to talk to you about some of my research in using AI to predict mental health on social media data. In one paper that I focused on with prediction, we examined 26 million posts on Instagram. We partnered with clinicians who have an eating disorder clinic to build a system that combines computational linguistics and machine learning that study high-risk behaviors in online communities. These are 3 examples from our data set of posts that people put on these hashtags related to self-injury and suicidal behavior. Using our computational system, we were able to annotate every single post in the dataset and predict high-risk behavior on a 1 to 3 scale, where 3 is the highest or most risky behavior. This is what our clinical collaborators would be worried about if they found this kind of behavior or found out about it from their patients in therapy. Things like idealizing certain body parts as somebody loses weight, or graphic photos of people cutting themselves. These are the kinds of things that people post to Instagram. And a lot of them are really worrisome when you take them within that context. However, one of the novel findings from our research was that despite there being a growing presence of dangerous content related to mental illness on this platform, most people posted things unrelated to mental illness. 85% of content was labeled as risk level 1 or low risk. And even for users who had high-risk content on their profiles. Many of the posts discussed everyday activities like getting new tattoos and traveling. Now, we can use AI and machine learning to predict mental illness, but we can also use it to discover new information and new clinical and medical insights as well. In another study, we examined 90,000 Reddit posts, that described people's behaviors as they recovered from opioid use disorder. To support their efforts at recovery, individuals talked about using a wide variety of substances to decrease their withdrawal symptoms and ease their craving for opioids. And if you're familiar with opioid use disorder and recovery, being in recovery is like having the flu for 6 to 12 weeks and comes with psychological symptoms such as depression, anxiety, and a lack of interest in doing anything fun. So what we found were 20 substances that people were using to support their recovery efforts. And this is an amalgamation of different kinds of substances, including prescription anti-anxiety and antidepressants, substances with contested legality, or what we would call gray market substances, illegal drugs, and even over-the-counter medications and vitamins. You may recognize some of these substances like Valium, gabapentin, and magnesium. And I want to give you a taste of how these are being used to support recovery behaviors in online communities with 2 quotes that I found from people who were trying to recover from their opioid addictions. For this person, they used kratom to help them get clean from heroin and were able to use the kratom to taper off their heroin, and they've been clean for 2 months so far. Now, this person and many, many others on Reddit praised kratom as a life-saving substance, helping them kick the habit of other stronger substances. Kratom has been used in Southeast Asia as a tea for many centuries to support healthier work practices and alleviate pain. And now people in the US are purchasing this gray market substance on online marketplaces to help them to help support them as they wean off of other opioids. Now, obviously everything isn't so rosy, because that wouldn't be exciting, would it? What we also found was that people were abusing substances like Suboxone and loperamide, or what you may call Imodium, to help support their recovery efforts. Now, Imodium or loperamide is an antidiarrheal drug that's commonly used to stop one of the more uncomfortable symptoms of opioid recovery, which is the relief of chronic constipation. But we see people using it to help them recover. This person claims to take 1 bottle of 64 doses, or 64 pills, every 12-ish hours, and they use it to get high like opioids. They were previously on other opioids and Suboxone, a known recovery substance, but people are now getting hooked on loperamide, to the point where people have come up with the slang term LOPE, short for loperamide, to describe their addiction to this new substance. And this is worrisome from a recovery perspective, because loperamide we don't know how it affects people at high enough doses. There's only a few clinical case studies in the literature that talk about the use of LOPE at such high doses, to the point where people will blend these substances up like a smoothie and take 64 to 70 pills at a time. Now, this worries me from a clinical perspective, but it's hard to deny the efficacy of other substances like kratom at supporting people from recovering from heroin and fentanyl addictions as well. And these uses of these substances for harm reduction behaviors is really important to consider when thinking about substances like abusing Imodium in these communities. Now, I want to talk about what I think is kind of the elephant in the room, which is that a lot of this stuff is still research. Some of these substances, as I mentioned, had only been confirmed through clinical case studies of 1 OD in an ER. Even in the best case systems, where we're building AI built on really solid data, we're looking at about 80 to 85% accuracy in the best case. Said another way, that means 1 in 5 predictions are wrong. And there's a lot of risks of poor predictions in this space. Not only erroneous or bad machine learning models, but also bad scientific standards or medical outcomes. There's also the risk of bad AI systems in causing discrimination and injustice. You may have heard of some of these impacts of the use of facial recognition technologies on people who are of different skin colors, and how performance dramatically drops on darker skin tones. For AI and mental health, I think that there's a lot of risks for poor predictions, and we need to be mindful of those as this research moves forward. But I want to pause for a second, because I think that there's a really important thought experiment here. Models won't be bad forever. And imagine a world in which all models perform perfectly, 100% accuracy, they always get the mental illness predictions correct. What are the risks of accurate or good predictions in these systems? Right? We actually have a lot of risks of perfect prediction systems, because they may cause lots of unintended and unanticipated consequences that we as scientists and researchers, app developers, and providers are now responsible for. This includes reproducing data biases, whether those be embedded directly within the social media data or in diagnostic standards that are used to build these systems from the ground up. There may also be malicious actors that use this information to discriminate against people for having a mental illness like depression, anxiety, or suicidal ideation. And I think that there's the big question of, is this something, or is mental illness something we should even be predicting at all from these online communities? I think that this pushes us to start reconsidering our role in diagnosing and treating mental illness with AI system, and the importance of responsible practices and ethical practices that use social media data to diagnose and treat mental illness. We will need, and we do need, approaches that are more thoughtful, more socially aware, and responsible, And it's important for us to pause now before the mass adoption of these systems into practice so we can figure out the best cases and the best solutions moving forward. Which is where my talk turns now to some perils and pitfalls of building these systems that use AI for social media data or on social media data for mental illness. And I want to talk about two examples in particular. The first is the example of Samaritan's Radar. This was an app released on the App Store in 2014, and the goal was to look out after your Twitter followees and see when they posted something worrisome or concerning. This person said that they just wanted to die, and Samaritan's Radar would therefore alert you, because you follow them, to make an intervention, right? They would want you to reach out using their technologies. Now, Samaritan's Radar had a lot of promise built into it because it was built by a charity, and it provisioned social support for those who are thinking of harming themselves, which clinically speaking is one of the most effective interventions we know of to prevent someone from taking their own life. However, Samaritan's Radar received a lot of public backlash and was removed on the App Store within 2 weeks because followees couldn't consent into being followed, and people used the radar to bully and harass people when they were at their most vulnerable. Now, I want to juxtapose this example against the case of Facebook's AI system to prevent suicide that I mentioned earlier. I bet many of you didn't know that Facebook has the system deployed. Many of you have Facebooks, and Facebook is now surveilling you to predict suicide or to predict whether or not you may take your own life in the future. Are there meaningful differences in Facebook's intervention, which is not actually controlled by a person, compared to Samaritan's Radar on Twitter? I think that these two examples clearly show that there are differences in people's expectations of access to their data by others, and whether or not people may consent into being monitored for AI prediction systems like Facebook, or like the sort of lower tech version that Samaritan's Radar implemented 6 years ago. I also think that these two examples are cross-cut into legal restrictions and interesting law practices, things like HIPAA and GDPR, but also the social expectations of how law intersects with mental health and the protections of people and the responsibilities of those to intervene. Here's another example from my data set that happens frequently on Instagram. This woman is wrapping her hands around her thigh to track the size and the change of her thighs as progress. And she's posting to #Anna, #anorexic, two communities on Instagram that promote eating disorders. Now I want to have you pause for a sec and do another thought experiment. If you saw a friend post this, what would you do? Now, here's what you may do. You may like the post or post a supportive comment. You may report the post to Instagram because you don't want to see it on your feed. You may reach out to them in private. You could also ping one of their friends that you know is closer to them and also have them reach out. Or maybe you just keep scrolling. All of these are actually really valid options of how you as an individual should intervene in someone's mental illness, a post like this. And quite frankly, the reason that they're valid is because there's no clear guideline on what we should do as people to support individuals when they're talking about severe mental illness. And it's now up in the air what social media sites and other actors that are involved now in the sharing of this data on their servers should do to intervene. What we do know from our research and some prior work that we did on Instagram is that banning hashtags and banning people actually makes content on the site worse. In 2015, Instagram banned a slew of what they called pro-eating disorder hashtags, things that people would post pro-eating disorder content that encouraged calorie restrictions and aggressive dieting. In short, what we found is that that didn't work. And it actually made the content on the site much more vitriolic and dangerous for people who were engaging on sort of the variant hashtags that popped up after them. Instagram didn't get the results that they had expected with their bans. But ultimately, Instagram made a decision to try to do something about these behaviors. And this gets at an important question. Should Instagram and Facebook be doing something about this? Whose obligation is it to intervene when a friend like that posts content on their social media site? Now, I'm leaving this talk a little bit unanswered, with a lot of unanswered questions, both in developing AI systems for mental illness, as well as what we should do about a lot of these behaviors. Now, I've pitched a couple next steps here that I think would be helpful for us to consider as a community. Things like bringing key stakeholders into the process, like the people like that woman on Instagram who is being predicted on by algorithms, as well as better practices in machine learning and compassionate and responsible interventions that look less like what you see in online or on the TV and more like compassionate and well-educated ways to interact with people who are struggling. I'm excited to see us solve these challenges and see how we can apply this work to issues in applied AI that connect us to people who are struggling with mental illness, and how AI can be used to support better goals and better health for people in online communities. Thank you so much for listening. I appreciate your time. Please ping me on email or on Twitter if you have any questions. Thanks so much.